Good morning, everybody. Welcome to your 8th online lecture. Today we'll be discussing the disinfection, sterilization, and aseptic techniques. Uh, this is an important lecture because it has practical significance for all of you. So, what are sterile precautions? These are steps or procedures to reduce wound infections in order to reduce morbidity, mortality, and cost of healthcare. So, sterile precautions are the steps that healthcare workers and hospital staff take to prevent or reduce wound infections, and as a result, it results in reduced morbidity, mortality, and reduced cost of healthcare. Now, surgical site infection or SSI is an infection that occurs after surgery in the part of the body where the surgery took place. SSI rate can be calculated in various methods, various scenarios, however it is required. Uh, the commonest would be the number of surgical site infections divided by the total number of surgeries multiplied by 100, and that would be your surgical site infection rate at any one time. Now this can be time restricted. You can calculate the number of infections over divided by the total number of surgeries in a certain month or a certain year, and there are the numerator, of course, in these calculations is the number of infections or the number of patients infected. If we go into details, infections caused by multiple organisms of similar origin at the same site are considered a single infection. However, in a patient with a previously established hospital-acquired infection, a second hospital-acquired infection should be recorded as in two situations: the appearance of a clinical infection at a new and different site, and the appearance and culture of new and different organisms if deterioration in the patient's condition takes place. So, for the record, such a case would be considered as two infections, not one infection. The denominator can be the number of patients admitted, or the number of patients discharged, or the number of hospital days in the patient spent in the hospital, and the number of device days, for example, on ventilator, etc. Um, Device specific rates can be calculated. Then you can calculate the ventilator and the catheter related, IV catheter related infection rate, number of catheter related bloodstream infections, and number of patients on IV line days. So infection rates are calculated like this, and hospital-wide rates of nosocomial infections may also be calculated. Uh, However, this is not our primary topic today. These calculations need to be adjusted for the risk factors. I just wanted to introduce you to the subject. And the surgical site infection rates are proportionate to the number of bacteria that are introduced into a wound and the types of bacteria and their virulence. Uh, there are special circumstances. For example, in dental surgery, you will be most of the time um, doing surgery on through the mucous membranes, on or through the mucous membranes. Mucous membranes are different to the skin. Skin is much harder and much more resistant to chemical agents. So, certain chemical agents which can be used on the skin may not be appropriate for using on the mucous membranes to decontaminate them. The mucous membranes of the mouth, as you know, contain millions of commensal bacteria, many of which are opportunistic, and if they gain access to deeper tissues, they can cause infection. Similarly, antiseptic solutions, which may be viable for the skin, may actually burn the mucous membrane or may get absorbed and cause poisoning. So, these things need to be considered. Then you need to consider existing infection and its site in the body. Um, if it is close by to where you are going to operate, you must consider whether the existing infection can spread to your clean operation site. And then, in the use of prosthetic implants, an infection in the body anywhere can cause bacteremia, and these bacteria can through the blood stream reach the prosthetic implants that you might be using, and they can lodge there and cause distant infection around the prosthetic implant, which may necessitate its removal. So all of these things need to be considered when you are trying to prevent surgical site infections or infections per se. The sources of bacteria are either endogenous or exogenous. The endogenous bacteria would come from the patient's viscera and from the patient's skin. So it can be either the skin or the mucous membrane. And exogenous contamination could come from the air, the surroundings where the cut, surgery, or injury is taking place. The contamination can be from the instruments that are being used or with the surgeon's hands, and it can come in roadside accidents from the injury surroundings and the impacting surfaces. So basically, decontamination is our subject today, and decontamination consists of three main parts, that is cleaning, disinfection, and sterilization. All three combine under the heading of decontamination. So decontamination consists of cleaning. Cleaning is essential to physically remove, either through wiping or through washing, as much of the contaminants as possible before proceeding to disinfection or sterilization. So the idea is that you don't take a instrument contaminated with dried blood or fecal matter or pus, and you don't put it in an autoclave to sterilize it, because the bacterial load on that instrument and the coating on that instrument is maybe thick enough to prevent sterilization and may ultimately cause cross contamination. So every contaminated instrument has to first washed and wiped to clean it as much as possible. This will of course not remove the bacteria totally, but it will definitely reduce the bacterial, fungal or viral load on that object. Disinfection is the second type of decontamination, and the objective is that it significantly reduces the number of viable organisms on any surface or object. It does not necessarily inactivate spores, and it does not totally destroy any microorganisms on the subject, instrument, or surface. Disinfection can be low disinfection, medium, or high, depending on what type of disinfection is being used. The third component of decontamination is sterilization, and the objective in sterilization is complete destruction of all harmful microorganisms from any inanimate objects and surfaces. It is effective against viable bacteria, viruses, and spores. So there are three levels of decontamination. One is just cleaning, the second is disinfection, and third is sterilization. In cleaning, the objective is to physically remove all visible and invisible contaminants on any object or surface. Simple washing with detergent, soap, and water, brushing and dismantling of instruments to wash all surfaces is called cleaning. In the operation theater or in your surgery, dental surgery, you will see that immediately after use, the instruments are first washed and then they undergo disinfection or sterilization. So the first step is cleaning. Disinfection, where you want to minimize or reduce as much as possible the bacterial, fungal, or spore contamination of the instruments or inanimate objects. And this can be generally done in two main ways. Use through use of chemical agents or use of physical agents. Chemical agents include alcohol, formaldehyde, glutaraldehyde, sodium hypochlorite. Physical agents include low temperature steam and boiling water. Please remember, we're talking disinfection, we are not talking sterilization. So, chemical disinfection, the commonest use is alcohol. You must have seen in your wards and in the clinics alcohol swabs being used. It is a liquid disinfectant, and concentrations of alcohol above 70% can kill 90% of the bacteria. Remember, this is not 100%, this is 90% of the bacteria on skin within 2 minutes. So, please remember that time factor is also important for how long the alcohol stays on the skin. The response of fungi and spores and viruses to alcohol is unreliable and erratic. So, at least 2 minutes the alcohol must remain for any significant effect on the bacteria. 2 to 8% formaldehyde. This is normally used in the form of fumes or vapors. It is a pungent liquid, and therefore it is used in airtight cabinets where the gaseous formaldehyde is circulated. The fumes or the vapors of formaldehyde are circulated, and these disinfect the instruments, wires, pipes, etc. And these fumes or vapors can also be used to fumigate operation theaters and isolation rooms. And except for the pungent smell that this leaves behind, the room or the theater has to be ventilated afterwards to remove this pungent smell. Otherwise, it is a good effective method of cleaning large areas and rooms or large containers. 0.1% sodium hypochlorite is available in liquid concentrate form, and like bleach that you see, it releases chlorine and that oxidizes the fungi and viruses and the cell membrane of the bacteria, etc. However, the tubercle bacilli are relatively resistant to this. It is generally used to disinfect baths, cradles, furniture, and lavatory seats, etc. 2% glutaraldehyde, or the trade name Sidex, is one of the commonest use liquid chemical disinfectants in hospitals, and it is effective against most of the bacteria and viruses, especially hepatitis B, C, and HIV. This is particularly useful for dipping endoscopes and leptoscopes and other instruments, and generally 15 to 30 minutes are enough for the instruments to be decontaminated. But please remember, first the instruments are washed, then placed in the glutaraldehyde solution. And because this is a irritant chemical and cause skin irritation, mucous membranes irritation, or even allergies, uh, after the instruments have been dipped in this solution, they must then be washed with normal saline, sterile normal saline, and this chemical must be washed off the instruments before they are actually used on the patient. The degree of contamination, decontamination is proportional to the time of immersion. So you can either immerse them for 15 minutes, 20, 30 minutes, even 1 hour, depending on what sort of decontamination you are trying to do. 1% hydrogen peroxide, vaporized hydrogen peroxide can be used within closed cabinets or to fumigate large rooms or large containers containing PPE and masks. Specialized low volume vaporizers and defoggers are used, fogging machines. Physical agents that can be used for disinfection are low temperature saturated steam. So, so at 73 degrees centigrade for 20 minutes, um, heat sensitive objects like plastics, rubbers, and other instruments, they can be placed. And please remember, we are talking disinfection. This can work in clean surgeries or even in dental surgeries where you already know that the mouth is place for home for a lot of commensal bacteria and you can never eradicate all of them. So you are not, your objective may not be absolute sterilization. It may work, but recommended is that you try for sterilization instead of simple disinfection. Similarly, boiling water, as you all might know, before the advent of disposable equipment, uh, every clinic used to have sterilizers. They were called sterilizers, although time proved that they were not sterilizing because they were boiling water at 100 degrees centigrade, and it was basically disinfection for glass syringes, for stainless steel instruments, and needles, etc. Later on, when sterilization techniques were further understood, then these disinfecting boiling water was abolished. Now we come to sterilization, and please remember, in sterilization the objective is to totally eliminate any pathogenic microorganisms on inanimate objects and surfaces. So the first method of sterilization is heat sterilization, and in heat the commonest that is used nowadays in hospitals is steam sterilization. Uh, if you remember your physics, steam can go and take temperatures much higher than 100 degrees centigrade. Water can maximum achieve 100 degrees centigrade and then it begins to evaporate. And once you introduce pressure on it, then even water temperature can go up, but steam temperature can be raised much higher, and that makes it far more effective than compared to boiling water. So steam sterilization is done under pressure in an autoclave. Autoclave is like a big, huge pressure cooker where the water chamber is separated from the instrument chamber where the sterilization is intended, and only not the boiling water, but only the steam reaches that instrument chamber, and the build of the autoclave is such that it can sustain a lot of pressure. As the steam continues to accumulate, the pressure in the instrument chamber keeps increasing, and therefore makes this a very effective sterilizer. Um, Autoclaving kills all bacteria and viruses, including hepatitis B, C, and HIV, and all spores, including Clostridium tetani, etc. So, three criteria are generally used to monitor the steam sterilization in autoclave, that is time, temperature, and pressure. So, if the steam is maintained at 134 degrees centigrade and the pressure is maintained at 30 pounds per square inch, then even 3 minutes in the autoclave would be enough for sterilization of the instruments. However, generally what is the protocol that is used is 121 degrees centigrade, 15 pounds per square inch pressure for 15 minutes. Uh, there is a pre-vacuum cycle, which may be gravity activated or suction vacuum pump initiated. The idea is that air present in the autoclave when you start put the instruments and close the lid, there is air present in the chamber, and that resists the steam coming from the heating chamber into the instrument chamber, and prevents it from reaching all the corners of the instrument chamber. So the air needs to be drained either through the pressure of the steam itself or through active suction from the uh, instrument chamber. This is called a pre-vacuum cycle, and generally in advanced autoclaves, this is a prerequisite uh, when you start doing autoclaving sterilization. So as I explained, you have to, when you've started the autoclave, you have to first do the pre-vacuum phase where the air inside the instrument chamber or the sterilization chamber is removed or allowed to go out under the pressure of the steam, so that the steam can then occupy all the space in the instrument chamber. As I said earlier, three criteria: pressure, temperature, and time are monitored. The penetration of steam to different corners of the chamber can be done with the Boetic test. In this, a disposable test pack is placed in the empty chamber of the autoclave, and this is done before the pre-vacuum phase. That means the air is allowed to stay in, and a 4-minute cycle of sterilization at 270 to 273 degrees centigrade is done, and this disposable test pack has patterns on it which change color with the heat, and once you remove them from the chamber, you look at them, and if the color has changed uh, on the whole paper, the whole sheet, symmetrically, then that means that the penetration of steam to all parts of the autoclave was good, and this chamber is good enough for sterilization. If there is patchy discoloration or color change on this test pack, then the autoclave needs to be examined by an engineer to see what is wrong with it. Then there are chemical indicator tubes and tapes whenever instruments or packs are placed inside the autoclave. These are color changing tubes and tapes are placed strategically among the objects to be sterilized, and if the, higher temperature steam reaches them, they change color, and at the end of your autoclaving cycle, when you're removing the instruments or the packed gowns, etc., you look at the indicator tubes, and if they've changed color, then you can be sure that your all the packs and up to the back of all the chamber, everything has steam has reached everywhere and sterilization has been done. Then there is hot air sterilization. You will see this commonly being used in dental surgeries. Please remember, dry air is less effective than moist air, but it is good enough for um, treating metal instruments like your drill bits and your metal instruments used in dental surgery. In addition, for non-aqueous liquids, grease, ointments, airtight containers, especially if the containers are not made of plastic. Um, Lesser temperatures for prolonged time can be used in case of plastics and rubbers, but generally, if other better methods are available, hot air sterilization is restricted to ceramics and metal objects. The second type of sterilization is chemical sterilization, and commonly used chemical sterilization is ethylene oxide sterilization. Ethylene oxide is a gas which can penetrate through paper and plastic, and it is a non-corrosive with broad spectrum bactericidal, virucidal, fungicidal properties. So, a lot of times you will see dental instruments packed in envelopes with plastic on one side and paper on the other side. The after washing, cleaning the instruments are placed and sealed in these packages, and these packages are then sent for ethylene oxide sterilization, and this ethylene oxide passes through the plastic and paper and sterilizes the instruments inside, so that uh, the same instruments can be reused the very next day for your outdoor patients coming for treatment next day. It is good for using in heat sensitive materials, sterilizing heat sensitive materials like disposable syringes, cannulas, plastics, rubbers, and of course non heat sensitive material like metal instruments, etc. 2% glutaraldehyde we already studied in disinfection regarding disinfection of endoscopes and laparoscopes, and if the exposure to the glutaraldehyde, the instruments, the endoscope or the laparoscope is dipped for longer periods of time, that can actually result in sterilization and not just disinfection. Then there is low temperature steam and formaldehyde sterilization, meaning thereby that you are not using high temperature steam and you are adding formaldehyde fumes to this steam and to achieve sterilization. Sterilization in this case is achieved at just 73 degrees centigrade, and it is useful for heat sensitive material like equipment with plastic components. Uh, these autoclaves or these ovens are different to the high pressure, high temperature autoclaves. The third method of sterilization is radiation. Gamma rays or accelerated electrons are mainly used, and in factories, pharmaceutical manufacturing factories, gamma rays are used for in bulk sterilization of heat sensitive objects like cartons containing syringes, catheters, and IV cannulae. So, clean um, syringes, catheters, IV cannulae are packed and then placed in cartons and the whole carton is then subjected to gamma rays, and it sterilizes the carton, the inner contents, and all the objects placed inside the packing within those cartons. So this is used for rapid sterilization of heat sensitive material in factories where they are being manufactured. Um, the equipment is costly and it cannot be used for small enterprises. Um, a sort of a summary of the whole process: heat sterilization. Uh, these are the sterilization methods and what objects these are suitable for. Heat sterilization, steam under pressure, autoclave, stainless steel, titanium, autoclavable alloys, surgical instruments, cotton, linen, gowns, dressing materials, bandages, gauze, surgical gloves, etc. You can go through this table. Gamma rays and hot air ovens can be used to sterilize casters, syringes, rubber, IV cannulas, which are made of Teflon, and then fine cutting edge instruments, for example, ophthalmology and hair transplant. These are very fine instruments. So hot air ovens or gamma rays can work in sterilizing these instruments. Ethylene oxide, as I've already discussed, packed heat sensitive material, plastic, rubbers, or your dental instruments. Sidex or Steris, these are trade names, chemical agents which are used to sterilize endoscopes, laparoscopes. 0.1% sodium hypochlorite. As you remember, like bleach, this releases chlorine, and this is used to disinfect baths, cradles, furniture, and lavatory seats. Then we talked about vaporized 1% hydrogen peroxide, which is used to fumigate OT and rooms, isolation rooms. Uh, and as we know nowadays, they are using these in large containers to sterilize used N95 masks. Uh, Chemical povidone, iodine, pyodine, and alcohol 70% plus alcohol, and Dettol, etc., or Savlon, as we used to have previously. These are the agents which are used to disinfect skin of a patient. Uh, Please remember there is a time factor involved. For example, pyodine must be allowed to sit on the paint after being painted on the skin. It must not be wiped off for 5 to 6 minutes before you give the incision. Same applies to alcohol. It must sit on the skin for at least 2 minutes for 90% disinfection. Uh, Alcohol 70% plus 70 to 90% can also be used to dip thermometers in or to wipe stethoscopes with to disinfect them. Formaldehyde fumes, chemicals in closed containers or cabinets can be used to decontaminate respiratory therapy equipment like respirators and ventilator piping and masks, etc. So generally, the protocol or the method for equipment sterilization and disinfection would include the following steps. They must be first thoroughly cleaned, and then they must be packed appropriately to ensure adequate penetration of steam to all the instruments in that pack. All surfaces should be directly exposed to the agent, and certain instruments where like laparoscopes may need to be dismantled. Instruments in laparoscopic surgery may need to have their external sheets removed so that all surfaces are exposed to the steam. And chemical indicators must be used routinely so that you know that the steam has reached all parts of the pack, and thermal and biological indicators are also used uh, to ensure adequate sterilization. So in the operation theater, the common things, this would apply to your dental surgery also to some extent. Air sterilization or laminated flow in the operation theater prevents outside dust and contaminated air from entering the operation theater and expels the air in a certain laminar flow. 20 air changes are required for an operation theater per hour. So the speed of airflow needs to be monitored, and in advanced operation theaters, a minimum of 20 air changes per hour are maintained, and the intake filter of this air circulating system is maximum 5 micrometer size. So that filters 95% plus of viruses and bacteria. Um, uh, Plus, another factor is that positive pressure ventilation is maintained within the theater so that the air is flowing out of the theater into the galleries and the other OT complex and not being sucked from the galleries into the operation theater. Then you have to maintain a certain discipline in the operation theater. No unnecessary personnel should be in the theater and they should maintain minimum movement because movement moves dust particles suspended in the air or on the clothes and they may land on the operation site. And doors of the theater must remain closed so that outer dust cannot come in and talking should be maintained at a minimum level because for every 100 words spoken 36 bacteria or more are generated and they can then land on the operation wound and cause infection. Staff health is very important. Staff with skin infections, boils, paronychia, carbuncle, or carrier state for any disease, and especially respiratory tract infections, they must be excluded from the surgery, from the operation theater, because their infection can be contagious and may contaminate the operation trays, the instrument trolleys, the instrument trays, and the instruments, and be then conveyed to the patient. Uh, Cotton suits under cotton gowns are sufficient for general surgery and for dental surgery. Generally, there are studies which show that caps and masks and gowns do not reduce infection rate in clean general surgery. Although, to err on the side of more precaution and safety, they are commonly used. Uh, Aesthetic for patients' satisfaction and for aesthetics also. Masks also prevent when the patient or the doctor has upper respiratory tract or throat infections or nasal infection, it prevents that from being conveyed to the other person. However, in implant surgery and orthopedics, every precaution must be taken to prevent contamination. Brushing is generally only required under the fingernails to remove any dust, dirt, grime that may be lodged under the nails. And when you're scrubbing for a clean surgical procedure, again the time factor is important. If you're using chlorhexidine or pyodine scrub, povidone iodine scrub, then you must scrub and keep washing for at least 3 to 5 minutes before you wash it off with water. Another method would be to wash 3 times with detergent, soap, and water, or with povidone iodine scrub. So each time you remove more and more bacteria from your or the patient's skin surface. When scrubbing to go to surgery, you must wash your hands from the direction of your hands to your elbow, towards your elbows. And similarly, there's a certain protocol for using the dry towel to dry your hand and forearm, and that also follows from the hand to the towards the elbow, not the other way around. So here is a summary of what precautions that can be taken by the hospital staff and what the patient can do to help them in preventing cross contamination and infection. Here you see cleaning and washing of hands and arms up to the elbows, alcohol based hand rub after caring for each patient or washing with soap and water. Um, if at all any area needs to be hair needs to be trimmed, then clippers are used instead of razors to shave that area, um, because microabrasions caused by the razor can help introduce microorganism into the skin. Then special hair covers, masks, gowns, and gloves are used during surgery to keep the surgery area clean. Please remember, many surgical procedures can take a long time to do, and the surgical team is sweating, and bacteria in the skin pores can then, with the sweat, come out. And if you're not wearing protective clothing, and then that can contaminate your instruments and the operation site. Wherever indicated, especially where implants are to be used, antibiotics, prophylactic antibiotics must be given, and 20 to 60 minutes before the incision is the best time to give prophylactic antibiotics, and generally they are continued for 24 hours after the first dose. And special soaps and detergents can be used to clean the operation site. What the patient can do is must tell the doctor about all the medical problems, allergies, diabetes, obesity, etc., smoking. They must quit smoking because smoking reduces oxygen supply to the tissues. These tissues are more susceptible to infections. Do not shave near where the surgery is to be done, because instead of shaving, clippers are used to prevent skin irritation and microabrasions. Uh, then the patient can point out if some nursing orderly or is not following protocols. You can discuss with your surgeon if they want to shave or be shaved or clipped, the hair need to be clipped or not. If you see somebody who's examined one patient and has come and started examining the other patient without in the meantime cleaning their hands, then the patient must speak up. And then what is very important in our circumstances is that family and friends who visit you should not touch the surgical wound or dressings, and they should clean their hands with soap and water or an alcohol based hand rub. Remember that the hand rub needs to be at least 60 to 70% alcohol. Uh, if you don't see them cleaning their hands, ask them to clean their hands. And then before leaving for home, please make sure that you understand how to take care of your wound, and always clean hands before and after caring for your wound, and make sure you know who to contact if you have any questions or problems after you get home. And if you develop any signs and symptoms of infection such as redness and pain at the surgery site, any drainage of liquid or fever, then you must talk to your doctor immediately. And the whole objective of all this exercise, today's exercise, is to reduce morbidity, mortality, and cost of treatment at your clinic or hospital through prevention of contamination, through using disinfectants and sterilization techniques. So here we come to the end of our eighth online lecture for BDS undergraduate students. Today's lecture was on disinfection, sterilization, and aseptic techniques. Thank you very much. See you next time with your ninth online lecture.